5 to 8 or 8 to 10. Friday night and Saturday. Unless it's just rain. That's the forecast. Unless it just rain.
All right, everybody, I'd like to, a few minutes over here, so I'd like to call the February committee meeting of the Health Committee to order. I'd like to start with attendance first. Rebecca, can you do the roll?
Sure, Mr. Chairman. Chairman Ray Joyce.
Present?
Mr. Reed.
Here.
Baston.
Here.
Collins.
Here.
Ms. McLean Lane is excused tonight. Mr. Miller.
Present.
Moriello.
Here.
Mr. Ward is excused. Ms. Willingham.
Here.
7 present, Mr. Chairman.
Thank you, Rebecca. And can I get a motion to approve the previous meeting
I make a motion.
minutes? Moved by Mr. Baston,
Second.
Collins, all in favor?
Aye.
Any opposed? Unanimous. Your current business. We have Department of Health with us tonight, Commissioner Long. Number 2, amending resolution number 127 for 2022 regarding the Public Health Fellowship Program and amending the 2023 Department of Health budget.
Good evening.
Good evening.
And with your permission, I'd like to introduce Rancy Moore, who has joined the Health Department as Assistant Commissioner for Finance, replacing Shannon Witherspoon.
Come aboard.
So the first item that we have is extending the contract and accepting additional funding for the Public Health Corps program. You may be familiar, this is an initiative that started out of the Cuomo administration to build up the infrastructure of public health, recruiting students of different levels, whether they're postgraduate or high school diplomas or masters or PhDs, to work with public health, and the hope is that we would be able to hire these individuals. We have subcontracted with Cornell Cooperative Extension to administer this, and it's going well so far, and in fact, we have hired our first person from the residency. So this is requesting permission to extend the program term to January 31st of this year, and having the additional monies in our budget of $507,000.
Thank you, Commissioner. Any questions for the?
Yes, please.
Ms. Willingham?
Thank you. Can you tell me how many people are in the training?
Yes, so the goal for the fellowship at this point is for us to have 7 fellows through Cornell Cooperative Extension. They have currently hired 4 to date. We took one of them, and they are looking to recruit an additional 3 people.
So what are their positions?
So they have a variety of positions. The one that works at the health department is currently working within the Division of Epidemiology. He did work that was very important during COVID and really developed a great skill set, and was found by staff to be a very engaging and helpful team member. So we were happy to be able to provide him with that role. And through Cornell Cooperative Extension, they're involved in a myriad of health promotion and disease prevention activities.
And so they're on the county payroll?
They're on Cornell Cooperative Extension's payroll.
Oh, I see, I
Yep.
see. Okay, and we're funding the program?
Yes, we're serving as a pass-through. It's coming from the state and then going to Cornell Cooperative Extension.
And it's supposed to end in June of 2024?
Yeah, I think that they have really, they've done a really good job of kind of beefing up the infrastructure at the state, which leads me to believe it will likely continue on past that, but at this point, that is what we know about the funding.
And everything is done out at where?
Cornell Cooperative Extension, and they're not at the Voorheesville location. Most of them are down on Green Street at their location there too.
Okay. So this was for, you said 7?
Fellows, yes, yep.
Okay. All right.
Yeah, with the opportunity to recruit more as more monies are made available.
Thank you.
Ms. Willingham, any other questions from the committee?
If there are no questions, I'd like to make a motion.
Second.
We have a motion from Ms. Willingham. Mr. Miller, all in favor?
Aye.
Any opposed? Unanimous. Thank you. Number 3, amending resolution number 441 for 2022 as amended regarding COVID-19 funding.
Thank you. This is for notification of an extension of the ELC grant, which stands for Epidemiology and Lab Capacity, for prevention and control of emerging infectious diseases. It comes from the CDC down through the state. This was a grant that I came and discussed with you at the last meeting to talk about an increase in funding, and this is the accompanying extension of time. Last time I was here, I talked about how we were using this grant within the school systems, and now had expanded to get air purifiers into daycares and after-school programs. So this money's being used for a myriad of disease prevention efforts.
Thanks, Commissioner. Any questions from the committee?
Make a motion.
You have a motion from Mr. Beskin. Do we have a second? Mr. Miller, all in favor?
Aye.
Any opposed? Number 4, amending resolution number 164 for 2022 regarding expanded partner services program and amending the 2023 Department of Health budget.
And this is a request to take additional funding. It's a relatively short period of time, which is why there's the $34K that's restricted. We're requesting that we can get a total of $67,000. This is a long-standing grant. Again, it is looking to engage people in care who are living with HIV, who have been seen to be fallen out of care, to make sure that they're on appropriate medications. And we have provided information on how that money will be spent.
Thanks, Commissioner. Do you have any questions from the committee? Hearing none, we get a motion moved. Mr. Beskin, second by Mr. Collins. All in favor?
Aye.
Any opposed? Unanimous. Number 5, amending resolution number 484 for 2019 regarding the National Diabetes Prevention Program.
So this is a term of extension that we requested from the grantor due to the fact that some of the grant-funded activities were put on a bit of a pause during COVID. This is for National Diabetes Prevention Program classes, which is an evidence-based strategy to help people that are pre-diabetic or have risk factors. The problem was a lot of these classes were at the time recommended to be in person. The CDC has amended that decision and now are allowing these classes to occur virtually. And so we wanted a little bit more time to get this, get the work of this grant done. And the additional program year will give us the opportunity to fully implement this program as well as increase awareness about it.
Questions from Muriel?
Question, how long has this program been in place?
So nationally or at the health
Health
department?
Department.
I'd have to check on that. I know it's probably been 3 or 4 years, maybe a little bit longer than that we have been working with community partners to conduct these efforts. It's a course over, I want to say 10 weeks, and people are given information on lifestyle prevention efforts, dietary, exercise, otherwise, to decrease the risk of developing diabetes. And it is very evidence-based and been shown to reduce rates of disease.
I was going to ask you that. I mean, do we have proof that this is actually working? Are participants actually becoming healthier?
So what we do is look at this in terms of completion, and then we look at the national data, because the numbers that we have doing this program wouldn't be enough to give rigorous scientific data, but when you say a strategy is evidence-based, it means that it has been proven nationally to decrease the rates of disease. So I could get you more information if you wanted to know what the prevention,
I'd be curious.
what
Sure.
the rates are.
Sure.
Yep.
Sure.
Happy to get some
But
more
we
information.
wouldn't know how successful we are here at the
So at the county level, as I said, the metric that we're more preoccupied with is really looking at the completion. Because we know if people stick with this, they have a much higher rate. And then we would take that and then extrapolate the success from what we know of larger studies.
Okay, thank you. Thank you.
So again,
Thank you. So how do people get into the program?
So we have a number of different community-based organizations that we work with to recruit people. And I can ask our public health education staff for more concrete information on that if you'd like it to.
Yeah, I'd be interested to know, since people of color are more predisposed to
Yes.
Diabetes, and you said this has been, what, this 2020?
I would say we've been doing it since longer than that.
Oh, longer than
Yeah,
that?
I'd say longer than that.
Yeah, I would really like to know what the numbers are.
Yep, be happy to give that to you.
All right, thank you.
Mr. William, any other questions from the committee?
Make a motion.
We have a motion from Ms. Willingham, we have a second.
Second.
Mr. Miller, all in favor?
Aye.
Opposed? Unanimous. Thank you, Commissioner. Mr.
Thank you
Warner.
very much. Have a good evening.
Dr. Giordano with Department of Mental Health. Right, Mr. Giordano.
Good evening, Mr. Chairman.
Number 6, amending resolution number 416 for 2021 regarding community residential and case management services and amending the 2023 Department of Mental Health budget.
Yes, and we spoke about this briefly a moment ago. This is the COLA. So each year I come before you with numerous contracts, pass-through funding contracts for our OASIS and our OMH providers. Those are all 100% state funded, and the state works in its own mysterious ways. They're providing kind of retroactive cost of living increases for some of those contracts that we've already approved and passed through. This is a request to amend the budget for a $70,000 approximate retroactive COLA for the year 2022, and it's the Addictions Care Center of Albany. It's no cost to the county.
Thanks, Dr. Giordano. Is the Addictions Care Center of Albany, is that a standalone agency, or are they partnered with other agencies across the county for these services?
These in particular are directly provided by them, standalone. They have multiple programs in their, they have a campus on the street, McCarty Avenue, right down the street from the FBI. And they run an outpatient program, residential program, women's residential program. There are many supportive living programs in that area.
Okay, so they're not associated in any way with Promessa, Acacia, or?
No, they're
any
not.
other way? No? Okay.
No, they are not.
Mr. Willingham?
Thank you very much. So, I'm just reading here the resolution. It talks about all of the different services that's provided. So, how do we recommend these people? Is that how they get to the Addictions Care Center? How does that work?
The recipients of their service?
Yeah.
From many different sources. They're referred from all over the state, from all over the county, all over the city.
Okay, all right. Do you know what the numbers are that we're taking care of as far as Albany County is concerned?
How many people they serve that are from Albany County? I don't, and I'll be glad to get you that. The breakdown has usually been across the many programs locally is about 80% of the folks are from the county and 20 from the region.
Say again?
80 from the county, 20 from the region has been generally the way these break down. Those numbers are kind of moving targets, but our expectation for the many programs that OMH and OASIS runs in Albany County is that they give preference to our residents, but not limited to.
And we can tell by the zip code or?
Yeah, sure.
Just, you know,
Oh, sure.
okay.
Yeah, we track all of that. I just don't have it off the top of my head, but
Okay.
we're often asked if, you know, sometimes even by the media, are we serving our local residents? Yeah.
Okay.
It's something that we track.
Thank you.
Sure.
Thanks, Ms. Willingham. Any other questions from the committee? If not, can we get a motion to move? Motion made by Mr. Beston, second by Mr. Collins. All in favor?
Aye.
Any opposed? It's unanimous. Number 7, amending resolution number 30 for 2022 regarding the COVID relief community mental health jail diversion grant program.
Yes, so this is an interesting opportunity that we have, and you've heard about this last year, and my recollection is that you were all kind of excited about it. We received a grant from OMH to try to replicate on the jail side what we've been doing successfully for many years on the prison side, which is a prison reentry program. We call it the Reentry Task Force. Some of you have attended and seen what we do, but the funding for that has always been limited to returning citizens from state prison, and we obviously have many people in our local jail that don't thankfully get to state prison. So We received a grant last year, and the goal of the grant was to come up with a strategy with case management and community stakeholder involvement to kind of mimic that. It's the pilot the state is doing in a number of jurisdictions, with the hope that if we could justify that the reentry efforts should be expanded to local jails as well, that there would be funding down the road. At any rate, this was very hard to staff last year because of all the workforce challenges that we've had, not just us, but many in this space. And so the state extended this grant for another year. So basically what we're asking for is to carry the unspent money into this year to continue the grant, to continue the pilot into the second year. And as I said, it involves case management, involves a stakeholder, it's called a sequential intercept mapping. I described that to you last year just very briefly. It's an attempt to get all of the parties where there is an interface between the criminal justice system and the mental health and addiction system, and to try to increase the likelihood of diverting someone at each of those touch points before they get to jail. And there's a science behind that. There's a group that does these mappings for us, and this would allow us to pay for that. The goal ultimately is at the end of this grant to have a white paper on the state of the mental health criminal justice interface in Albany County, which I'm still hoping that I'll be able to share with you at some point in the future.
Looking forward to it. Mr. Morial?
Just a quick question. You said this is a pilot program for
Yes, it is.
And any indication how successful it's been?
Sure. We've touched 26 people so far that were in our jail and have mental illness. One of the measures is, one of the goals is to reduce recidivism. None of those people have been rearrested, which is a good kind of indicator. The only caveat I would say is that we're not always privy to a rearrest. So, but we are working with people as they develop their plans to leave the correctional facility. We help them with housing services, social services, and stick with them until they get linked in the community. You know, if they get rearrested 3 years down the road, it's not really anything that we could have controlled necessarily. But so far, 25 people, no rearrests. And we weren't fully staffed, which is why they gave us the extension.
Okay, thank you. Thank you.
Sure. Ms. Willingham?
Do we have a mental health court?
Yeah.
Okay. Okay. Do you see any correlation between that and, you know, and this and?
So this.
And I want you to tell me what preventogenic means.
Yeah, that's not my language. That's the science, the criminal justice science. It refers to those factors that contribute to someone's criminal behavior, and there's a whole series of those, the criminogenic factors. And our interventions are to try to identify them and address them. What was the first question?
I forgot. No,
We have
the
mental
mental health
health.
court.
Oh, yeah. So this idea, we do have a grant plan, and that is to try to integrate our work at the jail with our mental health court and our diversion efforts, and that's what this community kind of mapping is going to be. Because, you know, and it goes beyond the boundaries of Albany County, as you probably can imagine, because there's like natural pathways between our contiguous counties, both on the treatment side and the incarceration side. But we're doing great work, I think, but there's a lot yet to do. Mental health court's about 1.5 years in its infancy, but starting to show promise, and it's all about knitting it together.
Who's the judge?
Riley, in city court.
Okay.
And he's really, I don't know if you know him, but he's very sensitive to the needs of the folks that are coming before him. He was overseeing the drug court in Albany City. So now he has both courts. And yeah, really, really wonderful temperament.
Thank you. Thank you.
Ms. Willingham? Sure. Any other questions from the committee? Hearing none, can I get a motion to Mr. Mariello, second by Mr. Collins, all in favor?
Aye.
Any opposed? Thank you, unanimous.
Thank you very much, everyone.
Thank you.
Thank you, Doctor.
Well.
Get a motion to adjourn.
Make the motion.
Please, Mr. Mariello.